Well, good morning, everyone. Is it morning still? Yes. Okay. Good morning, everyone. Welcome to Lifestyle Physicians. We wanted to actually start our live Facebook sessions now. We used to do it on a regular basis, and we wanted to start getting in touch with you again. So you'll see me or Dr. Verma every week talking about a health condition that our patients are interested in just kind of learning more about. So Lyme is a really hot topic right now, so I thought I should talk about Lyme. Many of my patients are coming in asking about preventing Lyme, or if they've had a family member who's had Lyme, or they have had a tick bite and they're kind of asking what they need to do. So I think education about Lyme is extremely important. So the first thing that I wanted to talk to you about, so for those of you who don't know what Lyme disease is or how it spreads and what are the kind of symptoms are, so I'll give you a basic introduction. Lyme is a multi-system inflammatory disease that affects almost all the systems of the body, including the brain, and it spreads by a bacteria, which is called Borrelia burgdorferi. And usually people that are at risk for Lyme are people that live in densely forested area, or if you live in the woods. So those are the people that are at risk because you can get bit by the tick, and those are the people that are coming into for prevention purposes also, or if they have had a tick bite, now they're nervous and they don't know what they need to do. So those are some things that I wanted to talk about. So if you do live in the forested area, which all of us in this area are, so because we live in the woods, right? All of us are close to, or we go for hikes. So you're at risk. All of us are at risk. So if you are bit by a tick, mostly it's people exhibit symptoms like you can have headaches, there's fever, there's crushing fatigue, body aches, there's relapsing fever, you may have cardiac symptoms like arrhythmia. Some people also have hallucinations, may have hallucinations or speech problems, like stammering speech. So, but the problem, what happens with Lyme is after you are bit by a tick, or if you didn't even see a bullseye rash, you don't have to see that, because if it's on a part of the body which is not visible, so for example, if it's on your back or back of your leg and you didn't see the rash, you may not know that you were bit by a tick, because so that's kind of, but if you're having all these symptoms, if you're having fatigue, if you're having chronic fatigue that you just can't deal with, you can't really go around and work at home or just your daily chores, and you're not able to do that, and you have headaches, or if you think that you have this crushing body aches, muscle aches, joint aches, if you have all these symptoms, even if you didn't have a fever, a really high fever after you got bit, or if you didn't even know you got bit, but you have all these symptoms, then that's maybe the time to consult a doctor who's Lyme literate. So conventionally, what happens is if you're bit by a Lyme, if you're bit by a tick, and you have fever, if you have headaches, or if you have the symptoms, even if you don't, some people start antibiotic treatments just to kind of just for prevention, and that's when people respond really well. So Lyme Medical Society recommends about 4 weeks of antibiotic therapy if you have Lyme symptoms or you've been bit by a tick. And some people also benefit from extended antibiotic treatments. Some people also get IV antibiotics, depending on how your symptoms are and how you're dealing, how your health improves. And some people do improve from those extended course of antibiotics, some don't. And then most patients come in and they say, after antibiotics, I've had these chronic Lyme symptoms, I've had this fatigue that I just cannot deal with. So talking a little bit about Lyme diagnosis is very controversial and not reliable. So what testing that's available is ELISA testing and Western blot testing. That's done right after if your doctor thinks that you have Lyme disease or you were bit by a tick. You may not have symptoms after getting bit by a tick for years, but it's really the cause of the tick being dormant is not really known. But you may not have those symptoms after years or after months of getting bit. So people then may start preventive treatment. So as lifestyle physicians, we offer a comprehensive Lyme disease treatment. So you come in, we offer a detailed comprehensive testing. So we not only test for Borrelias, Borrelia's antibodies, or we also test for other species and strains that can cause Lyme-like symptoms. And after we do the testing and we have a diagnosis, we start an integrative approach to Lyme, to healing from Lyme. We start with antibiotics. We also start with herbal treatments, antimicrobial, so we give you a combination of both. It will give you nutrients that can help build your immunity. We also offer IV nutrient therapy to boost your immune system, which is IV vitamin C. We also offer Myers cocktails to build your nutrient levels to help with that fatigue you have. We actually look at all of your nutrients level in the body to see what we need to offer or build up in the body to help you deal with that chronic fatigue or crushing body aches or symptoms. So we actually provide a comprehensive protocol to your Lyme symptoms. We're not just giving you antibiotics for a month, not just giving you that treatment and saying you're done. That's all we could do for you, or that's all we had. We actually provide a comprehensive treatment with consistent follow-ups. And as you improve, we add more treatments with herbal tinctures and herbal antimicrobials, nutrient therapies to help you heal from Lyme. It also includes a lifestyle change. So we look at your diet, your lifestyle, inflammation, if you need to be on an anti-inflammatory diet. Or if you need to, we look at your inflammatory markers and see if those need to be addressed. So, like I said, it's a comprehensive protocol. It's not just giving you antibiotic treatments and then say you're done with it. But if you do have more questions and you would like to learn more about Lyme, we have a Lyme talk coming in on July 13th, and we are asking people to RSVP. We have limited seating available. If you are interested, please call us and have our office put you in the system for that. And I'd love to see you on our live talk. And if you have any questions, I'll be happy to answer. And you can call our office to also see me in person if you like to, and I'll be happy to talk to you. Well, have a great weekend, and I will see you next week. Bye.